Apria Healthcare is the largest home healthcare company in the United States. We have over 500 locations and over 13,000 employees that service home respiratory therapy, infusion therapy, diabetic supplies, a variety of different home medical equipment as well. The business challenges we had were primarily in the regulatory area, where we had to meet a variety of different government agency needs as well as training needs across the organization, and a lot of that was dispersed across different disciplines as well as different locations. So by bringing in a content management system, we were able to pull in content and be able to deliver it to a diverse population in a variety of different locations without having to send out trainers to support that area. The content review cycle is a challenging one for us because there are so many people involved in our content review activities. And by having a system in place where we can use workflow to push the content from one person to another, that really helps us manage who gets what next and organizes our information really well. When we assemble and reuse content, we're really trying to take advantage of the ability of the system to support different disciplines in different areas. So if we've got content in sales, for example, or content in customer service, and it crosses over into different areas, we're able to reuse that and save ourselves the time of creating separate courses for separate disciplines. We have a lot of opportunities at Apria now that we've built up our repository of content to reuse it for different disciplines. So, for example, we can take content and reuse it for sales, for customer service, for, say, logistics. And if it's, for example, product information, we can reuse that content across all those three areas, but then define things a bit more specifically as we go down and create different types of courseware. Our ability to keep content up to date is a huge opportunity for us. The government regulations change constantly. Our market is changing in ways that is very aggressive, and in order to keep up with that, we have to have a dynamic delivery system to support all of our needs. And it's really exciting to be able to put into place edits or changes to a course and get that out to our end users really quickly, and they're able to take advantage of it within a day, really. We have a variety of testing opportunities at Apria Healthcare. We can do pre-testing, we can do checks for understanding, as well as having certification tests. It really depends on what the business need is. So as a result of that, we have to have very robust testing and the ability to create questions, update questions, and use them across different disciplines. Testing is something that we're able to do with a lot of flexibility at Apria now that we have Course 10. What we're able to do is create all the questions, use them for different purposes across different disciplines again. As well, we're able to track different detail of reporting and the detailed analysis that we need to do to understand whether our questions are actually hitting a mark or not. So it really it's a twofold process where we have really good testing and really good analytics to support the regulatory needs that we have to train. Reporting is really valuable to us at Apria because we are so heavily regulated and we have to report on who we've trained, when we've trained them, why we've trained them, and what those results were. And a lot of times we have the option to go in and quickly see how well people are doing on a test. Say we've enrolled 2,000 people in a particular exam. We go in after the first couple of days of people taking the course, and we find that one question is being answered incorrectly 50% of the time based on the reporting that we're getting. That allows us to go in, update the question dynamically, get that out to those remaining people who have completed or haven't completed the test yet, and they're able to take it accurately. So it's a really powerful tool for us to be able to make sure that we're getting the right information to the right people very quickly. When we look at scalability, Apria is constantly growing and changing. We recently acquired another 2,500 employees within our business structure, and we have to be able to support those employees with our learning management systems. So adding them to our learning content management system was a fairly easy process. And what it allowed us to do is get training out to thousands of people who had never experienced it before and are now able to use a variety of different tools that are within our Apria organization and get them acclimated to the new organization that they've now become a part of. The key benefits of using OutStart and the different products that they have available to us is meeting some of the regulatory requirements that we have, also being able to have rapid content development and support with additional products and upgrades to their products that they do on a regular basis. Typically, they'll provide upgrades to their products a couple times a year. And they really do listen to their customers when it comes to putting in the things that make sense for different organizations, but they also make sense in terms of global usage by business. So it's really exciting when a company takes the initiative to listen to their customers and implement those things within months rather than years of working with the software.